Hi, I'm Mabel Jong. Thanks for watching. I'm pleased to welcome Jay Sultan here today, who's with Trizetto, who will explain how this company fits into the healthcare landscape. Jay, thanks so much for joining me.
Thank you for having us.
Well, first of all, tell me about this IT software company that Trizetto is. What does it do, and how does it fit into what we're seeing in the healthcare space?
Sure. So Trizetto is the creator of a number of software products and associated services, business processing services, hosting outsourcing services, that allow payers to administer healthcare. And so our core systems are used to process claims for about 52% of the commercial population, and we're the ones that actually process the claims, process the benefits, authorizations, all that back office work, case management, administration, all those things that the industry needs to do to actually make the software industry run, it's the healthcare industry run, to actually be able to process healthcare claims. In addition to that, through our recent acquisition of Gateway EDI, we provide revenue cycle management capabilities for, as of today, 100,000 physicians in about 23,000 physician practices, allows them to manage the revenue as it's coming back from the payer in their own internal systems. What Trizetto is working on is really trying to recognize what we're calling the smart middle. The fact that more and more providers are taking on payer responsibilities, and payers are taking on some traditional provider responsibilities. And so the technology that we need has to be not just payer-focused or provider-focused, but really has to recognize these changes that are coming structurally in the industry and to find ways of facilitating and automating. Trizetto has always been a company that's emphasized administrative efficiency, and in many of our new service offerings, we're moving beyond administrative efficiency, trying to improve quality of care and efficiency of care through a number of new supportive concepts like payment reform, support of a lot of the new population health management activities that both payers and providers are needing to enter into.
Who's driving the demand now, the payers or the providers in this space?
You really see it coming from both directions. For payers, there's a tremendous need and desire to find ways to reduce both medical cost and administrative cost. MLR regulations certainly place a huge emphasis on finding ways to reduce administrative costs at a time that you can't just do less administratively. There's new mandates, there's new needs to control things such as the changes in medical cost. So we find that our payer customers are really looking to find ways to drive more value. And that's really, the buzzword in healthcare right now, but appropriately so. We've always been a fee-for-volume industry. And so as we think about value, it's not just how do we get more value out of the healthcare we deliver, but also if I'm going to spend money on certain types of administrative capabilities, how do I get more value out of my authorization process, out of my care management programs and those kind of things. From the provider side, we're seeing, again, a tremendous need to be able to simplify a lot of very difficult administrative things that exist for most providers today. Multiple payers, evolving software technology capabilities, new meaningful use and adoption of EMRs. All of these, along with the new payment models that the providers are now accepting, have led providers to need to have administratively scalable ways that they can do things like work with other providers, work with the payers who are coming up with these new types, or bringing these new types of payment methodologies. So for example, we've done some research at Trizetto where we found that one form of payment reform called payment bundling, that's being pushed by both sides. 80% of payers tell us that by the end of 2012 they're going to be doing payment bundling. 53% of specialists and hospitals tell us they're going to be doing payment bundling by the end of this year. So we're really seeing a convergence of requirements because of the pressures that are on both payers and providers to transform the system so it produces more value.
Okay. Well, Jay, I thank you for stopping by and explaining to us what this landscape is entailing and how Trizetto is involved. Thank you.
Thank you.
I'm Mabel Jong. Thanks for watching.